You call them arid species. I call them desert tortoises, same kind of thing. The land tortoises that usually get quite large and they mostly eat what we think of as grass or roughage around. They looked at what they eat and then they compare what we can buy in the grocery stores compared to what they eat. And it's absolutely wrong. If you have an insectivore and you give it what you think is a multivitamin, but it has beta carotene in it and not vitamin A, they're going to become vitamin A deficient.
How common is cancer really? And is this something that we should be concerned about, especially when it comes to overexposure of UV? Because obviously we're seeing a lot more UV usage, which is great, but is that causing skin cancer of any sort? So maybe I'll just let you run with that.
Yeah, I think that's a genuine concern about man-made UVB lights and cancer.
Welcome back to the Animals at Home podcast. My name is Dyllon Perrin, and today I am speaking with Dr. Kelsey Chapman, who is an exotic vet out of Calgary, Alberta. Now, if you follow me on Instagram, you know that about a month ago I posted a sort of Ask Me Anything Exotic Vet edition, and you guys submitted a bunch of great questions specifically for this episode. So in the last sort of third of this episode, we get into a bunch of the questions that you guys had, and Dr. Chapman answers those for us. Now, I think this is something we may want to revisit on a semi-regular basis. I think vet medicine, as far as reptiles are concerned, is somewhat of a cutting edge field, and there's also sort of an endless pit of questions that we all have and concerns that we all have. So if you would like to see Dr. Chapman as a semi-regular guest on the podcast, it's not going to be every week or anything, but maybe a couple a year or something like that. If we can accumulate some really good questions, I think that would be really helpful for everybody. So if you think that's a good idea, let me know. Now, in this episode, the first half, we really discuss nutrition myths and feeding myths. We discuss supplementation, specifically vitamin A supplementation, and what to look for on the back of the multivitamin jar that you buy from the reptile shop to make sure that you're giving your reptile what they need so they don't become vitamin A deficient. We discuss common food mistakes and myths that people make when they're feeding arid or desert species of tortoise. Quite often you'll see on Instagram and social media and whatnot, people feeding these really beautiful green salads with all these chopped up vegetables and whatnot, and to our eye that looks very healthy, but in reality these species are not designed to digest food with that much protein. So Dr. Chapman goes through what happens if they eat too much of that, what to watch for, and what to actually feed them to make sure their diet is proper and nutritional for the specific species. We also discuss providing water for arid species of lizard like uromastyx and bearded dragons. This is such a common mistake. We see people have this sort of image of a desert species never having access to water, and Dr. Chapman talks us through how bad that is and sort of the ailments that pop up due to dehydration. And of course, like I said, at the end of the episode, we do get into all those sort of rapid fire questions that you guys had submitted, including cancers. We talk about how to know what if your vet knows what they're talking about. We talk about what to have in a first aid kit at home, and a few other amazing topics that I think you will find very, very helpful. Before we jump into the episode, if you are looking for more information on this episode or any other, make sure you head to animalsathomenetwork.com. There you'll find access to the show notes for every episode that has been recorded. If you'd like to join us on Patreon, head to patreon.com/animalsathome. There you'll have early access to every episode, as well as the opportunity to join us on Keeper Chats, which is usually once a month. Myself and Liam from Reptiles and Research get ourselves and our listeners together and our viewers together, and we have like an online herp meeting. It is really fun, so if you want to join us on that, you can head to patreon.com/animalsathome. Thank you so much to CustomReptileHabitats.com for sponsoring this episode of the podcast. If you are looking for anything reptile related, head to the show notes or the YouTube description. There you will see a link. It is an affiliate link, so if you do use it and purchase something, a small commission comes back to me at no extra cost to you. And of course, that helps me support the show. And one last quick thing before we jump into the episode. As I said last week, as well as on Instagram yesterday, if you follow me on Instagram, I know I used to always post every single Sunday very consistently. I do want to get back to that, but it's going to take me some time now that, again, the baby is here. That's obviously priority for me. So the episodes are just going to be probably put out as soon as I'm done editing. So rather than saving them to every Sunday, I'm just going to edit and get them out. So I imagine they're going to be out anywhere between every 7 to sort of 10 to 12 days or so. I'm going to try to get back to the weekly schedule every single Sunday, but it's probably going to take me a couple weeks to get back into it, get a good backlog of episodes recorded and edited, and that way I can get back into a consistent schedule. So for now, the episodes are probably just going to come out in more of a scattershot fashion, and hopefully you guys are okay with that. And other than that, let's jump into the episode. Enjoy. All right. Well, Dr. Chapman, welcome back to the podcast. Thank you for being here.
Thanks. It's a pleasure to be here.
It's crazy. I think you were last on the podcast in 2019, which seems insane that it's been almost 3 years. It makes no sense.
Yeah. 3 years is a long time. A lot has happened in those 2 years.
Yeah, it's been a crazy at least 2 years anyway. Why don't we just quickly give, there's a lot of new listeners since you've been on last, obviously. So why don't you give people just a quick refresher of where you work and your work experience sort of education-wise?
So I graduated from the University of Calgary in 2017. So that was where I did my Doctor of Veterinary Medicine. So the schooling you do to become a vet. And before that, I was at UBC. I did a Bachelor of Science there, and what you usually have to do before getting into vet school. And then right out of vet school, I started working at an exotics only practice. So we only see the weird stuff, or I guess to everyone else, it's weird, probably not to your listeners. So 30% rabbits, 30% birds, and the rest is a mixed bag. I probably would say that I see the most reptiles at the clinic just because I preferentially take those appointments and the receptionists know that I like them the most. And so they send them my way. So probably 4 to 5 cases a day, reptile wise, would be a good guess.
Oh, wow.
Yeah, on average. Some days it's less, some days it's more. And I've been there the whole time. I bought into the practice about a year after I got there. I wasn't planning on doing actually exotic only practice. I was going to do cattle and horses and then do the exotics on the side because I knew I'd always liked them the most. But then I ended up in exotics only practice, and it's great.
Yeah, in some ways it's kind of a blessing to have an exotics only practice just because the volume of the same type of animal that you get to see, right? Like if you're just doing small animal where reptiles are more of a rare occurrence, it can probably be tough as a vet to learn how to treat them, I'm sure.
Yeah. It's hard. I mean, you can't know everything. There's just so much to know about all the different species. It's hard to expect someone who does dogs and cats. And there's so much medicine and so much research that's gone into dogs and cats because they're so common. It's hard to expect them to know everything about a reptile when it walks through the door and they maybe haven't seen that species before, they don't know what normal is. So if you do an internship somewhere, so it's kind of like someone in human medicine doing a residency somewhere, you get a lot of what you're doing. You're at a specialist place that does, maybe you're at an only reptiles place, or you're in that aspect of the hospital that does just reptiles. So you can do that aspect of practice. I get the same amount where I went, but I didn't go and do a specialty first. So I could now challenge board exams and be board certified, which is what you have to do to be called specialist. So that would be in the future for sure. I think that would be cool. You have to have 5 years of practice under your belt and then write a couple exams and papers. So there's definitely a process that goes through it. But yeah, that's you don't see as many reptiles if you don't do exotics only. So I'm lucky in that.
That's awesome. So you gave me a list of a few different things that we wanted to cover for sure. And I think it'll be, most of it's sort of diet related and some misnomers and some myths that are related to diet. So why don't we start with vitamin A just in general? So you can tell, maybe we should just start with the function of vitamin A in the body. And I think that there's, we have preformed vitamin A and then provitamin A. Is that right? Maybe you could just differentiate those. Yeah, go ahead.
Yeah, basically that's you got that totally right. So there is vitamin A in and of itself, and then there's some precursors that your body can make vitamin A out of. So carnivores, so to take snakes, for example, they eat whole prey. They eat the whole body, they get everything in it. And in a rodent's body, there's going to be a decent amount of vitamin A. They've already made it in their body. It's in the liver. There's a high concentration of it. So you don't see that in carnivores. But vitamin A is made from beta carotene. Beta carotene splits into 2 vitamin A molecules. You have an enzyme that does that. And certain species have that enzyme and certain species don't have that enzyme. So I think a thing that gets missed a lot is the idea that if you're giving your animal, like say, take an insectivore, because that's going to be where you're most commonly going to see this. If you have an insectivore and you give it what you think is a multivitamin, but it has beta carotene in it and not vitamin A, they're going to become vitamin A deficient. So you can think you're doing all the right things as an owner. I went to the pet store. It said multivitamin. It had a picture of a leopard gecko on it. I thought I was doing the right thing. Of course. And we can't fault them for that, but they absolutely need to have preformed vitamin A or they'll get certain conditions. So I'm sure a lot of your listeners have seen this before. A leopard gecko that has a thick kind of discharge in their eyes, which might look like a cap. It's obviously not a true cap in their eye, but it's kind of beige, or they have what looks like infectious stomatitis. So along their lips or their gum line, they'll have tiny little scabs. That usually is vitamin A deficiency in leopard geckos. And I see that a lot. So you'd have to find the right multivitamin too that has vitamin A in it. And am I allowed to say certain brands on here?
Yeah, go for it. Yeah. We're free here.
Reptile will have that. It's a yellow label. I can't remember which animal's on it.
I think it's the Jackson chameleon, or that's what it was.
Oh, is it? No, you're right. It is a Jackson chameleon.
Yeah.
Or some kind of chameleons on there.
What was it? Reptivite, right?
Reptivite. Yeah. Yellowish orange label. Yeah. So that one, all you have to do is read to make sure that it's a true multivitamin. So it's going to have a bunch of different vitamins in it. It's going to have A, D, and K, all those fat soluble vitamins, and it will list vitamin A. It can't say beta carotene. There's some other ones too, some retinoids that might be listed. So that's not true vitamin A. So
you want it to say vitamin A, or else it's because these animals do not have the enzyme to break the beta carotene down into the vitamin A. And what's the purpose of vitamin A in the body?
It does a lot of different things for keeping certain surfaces the same. So respiratory tract linings, stuff that's going on with your eyes. I think that's why there's maybe not old wives' tale, but everyone used to say, eat carrots, they're for your eyes because they have vitamin A in them. So what happens if you don't have enough vitamin A, the lining of your respiratory tract, your mucous membranes in your mouth, and then around kind of where you produce different tears in your eyes, a process happens that's called squamous metaplasia, which just means that where once you had cells that produced mucus, or ciliated cells, so the little cells that kind of move mucus up your respiratory tract, now you have skin. And so you can get chameleons, what they usually look like, they're bright colored, they look beautiful, their eyes are clear, they're open, even though they have like a tiny opening in their eye. When they have vitamin A deficiency, their eyes will squint and they'll think that, they constantly have an eye infection, or they'll have like swellings on their lips. And that's because those salivary glands or those mucus glands are blocked because it's with keratin debris instead of mucus that should come out.
Gotcha. And is that fairly reversible when the diet is corrected?
Not always.
Okay.
The biggest worry is that sometimes when you have squamous metaplasia, now you always will have it. But I would say that for the most part, if you can get them to a point where their diet is pretty good, enough of it can be reversed or at least stay the same where they can have a happy life still.
Okay. And other signs or symptoms of hyper or hypovitaminosis for vitamin A besides the eyes and the mouth? Because I imagine those must be sort of late signs, right? Like if you're starting to get the keratin build up, it's been a while.
You won't see it. You probably won't see it before then. You'll also see in red-eared sliders, their redness will be very dull.
Okay.
As well. And then you can get changes to where their ear is, kind of abscess looking things can happen too with hypovitaminosis A. Color change is common in chameleons as well. They'll be dull and not look very well. Plugs. So people call them sperm plugs, but it's not what they actually are. So when the hemipenes get like a smegma buildup in them, it's really just the change there too. There's a mucous membrane inside those hemipene sacs, and they can get more plugs that build up there and get infection, that kind of stuff.
And what we're talking about supplementation, as far as carnivores, so for example, with snakes, they're eating whole prey, like you said, they're getting everything from. Is there any supplement that you recommend for a snake? Like you sometimes see people like sprinkling vitamin D on things, or I've heard people supplementing with vitamin E even for carnivores. Have you ever come across that?
I think that you can. I think it's an okay thing to do as long as it's used in moderation, because vitamins A, D, and K are all fat soluble.
Right.
And a lot of snakes, I would say, are probably overweight, and some of them are larger animals. And so you can have hypervitaminosis A, so too much vitamin A. I feel like I've seen this in some snakes. I've definitely seen it in land tortoises. They're a big tortoise. They've got lots of fat, and you can make the skin slough so badly that it looks like third-degree burns, and they can die. This, I would say, unfortunately for my profession, maybe has been caused by vets more often than not. So seeing a land tortoise and thinking this is hypovitaminosis A, and then giving an injection for vitamin A, you can absolutely overdose it. People who've taken Accutane, essentially is the same kind of thing. It's like a retinoid type product, and it sloughs your skin so that hopefully that acne comes out. Mm-hmm. And it's the same kind of thing that can happen in reptiles if you give them too much. And it's just, it can be bad.
Interesting. Okay, well that's really good to know. So people with insectivores, they got to make sure they're getting the right. It's kind of funny. I always point a finger at the reptile manufacturers because there's these products that, like, you think that they would know that not to just put the beta-carotene in something that looks like a leopard gecko supplement when it's going to be no good. But so you have to look for vitamin A.
Yeah, and a lot of studies have come out not that long ago. We still don't know a lot about insectivore diets, the true diets. I'm sure if you were to sample an area, say where a leopard gecko came from or a chameleon, there's going to be hundreds of different bug species that they're going to eat. They're going to eat arachnids, they're going to eat all these different things. And then we offer it not just one species of insect, but just the larval stage. So I think we're, by keeping them in captivity, I think it's just a product of that and the convenience of having one certain kind of food. Yeah, I never answered the question about the carnivore thing. Should they get supplements in there? I don't think it's a bad thing to every once in a while put a multivitamin into the mouth of the mouse that you have thawed. But I wouldn't do it more than every maybe 2 months or so. And you have to hope, but you don't know. If you know where your rodents come from and they're getting a good diet, it should be fine. But if you just have rodents, they're being fed, say, one diet and you have a starving rodent, you're going to have a starving reptile. So if you know where your rodents come from, I think that would be awesome. But if you don't, I don't think that's a bad way to do it. And there's a lot of evidence too about, I think I mentioned this last time, a little bit controversial about UVB bulbs and snakes. A lot of them, though they are not true baskers, they do still, run through brush that loosely covers them from the sun in them, but they still do get it. And not just breeding wise, but some feeding and weight gain wise studies have shown that UVB lights can be good for snakes, but I'm not saying they all have to. It's just a thing that I think might be a good idea to consider. And if you're not giving them D3 in what they're eating, they might not be getting it. Also, if you keep your rodent in the freezer for too long, some of the vitamins do deplete. So over 6 months, try and throw them out is my rule. Well,
and it's a good reason to also vary the diet too, because if you're just getting the same rats from the same person, even changing a supplier could be helpful, or just changing the type of prey item and trying to mix it up. As far as the sorry, go ahead.
Or even the age of the
of the prey. Offering.
Yeah.
And as far as dusting or using a multivitamin for, we'll say back to the insectivores, what would be the frequency that you'd recommend for during the week? Is that like a couple times a week or?
And this isn't hard science. I'll definitely give you an answer. But I will be the first to admit that we don't study this as much as I would like us to do. There just isn't as much funding. There's not as much as dogs and cats. But I would say that straight calcium carbonate, not calcium gluconate or the other ones, because it's going to be the most orally bioavailable. And there are studies done on that too. I would dust every time to every other time that you feed. Pardon me. And then if you were to do a multivitamin, a true multivitamin, I don't think it needs to be more than every 2 weeks. Okay.
Interesting. Okay. That's good to know. That's a lot less than people think.
Yes. Oh, sorry to interrupt you, but D3 is a paper that just came out in the Reptile and Amphibian Medicine and Surgery Journal, and it was on blue tongue skink. And we've known this for a while, but it was an interesting case study that they did. Oral D3 can definitely be overdone in reptiles to the point where you'll cause renal failure, so kidney disease. So if you have a good quality UVB light and they're within 12 to 18 inches of it, and you have the right, and that's just a measurement, right? Like you can actually do the UVB meter measuring. So if they're getting adequate UVB light, they should be able to make that from their D3 from the sun they're getting. So providing oral D3 is always a worry because it is fat soluble and it will stick around in them.
Yeah. And that's a worry that I've mentioned on the podcast before, especially because a lot of the pre-made like crested gecko foods and whatnot all have vitamin D in them. And a lot of them do, not all of them. Arcadia has a line of food that doesn't have any vitamin D, and then you see all these people adding UV, which is great, but then they're also sort of pounding back, the oral D3. So it's good to know that it can be easily overdosed anyway.
Yep, it can be, unfortunately. And you never know what's in the powder, right? These things aren't regulated.
Yeah, that's the thing. Yeah.
And you just hope, and you hope that they're okay. There's been a lot of studies out of the States that look at gut loading insects and dusting them and what the insects are like when they come from the pet store. And a recent one that came out, Mark Mitchell is the main researcher there. He's a reptile vet in the States. And they'd show that superworms from the pet store their calcium to phosphorus ratio was like 1:8, which is, if anyone has looked at what the calcium phosphorus ratio should be in different animals, it's going to be different. So if you take saltwater crocs, when they're young, they eat a diet that's maybe 6 to 7 to 1 calcium to phosphorus. And as they get older, that's an ontogenic shift where they now eat a more like a 2 to 1 kind of ratio. But for the most part, your calcium should be higher than your phosphorus. So that's just, it's not great. So I think they recommend now, if you're going to have a mealworm colony or you're going to feed your insects at home, an 8% like dry matter basis, how much calcium should be in your food that you're feeding. So Arcadia, I like Arcadia. I will have to say I do like them. They have high calcium cricket feed that I think is really good. And I use it for my mealworms.
Yeah, no, that's good to know. Is there as far as all the different staple, quote unquote staple feeder insects, is there one that you really wish people wouldn't use? I mean, people always talk about you could overuse mealworms or overuse superworms. Is it more about variety, or is there one that you just like wish wasn't as common?
I think it's all about variety.
Okay.
A lot of them, even hornworms, get a bad rep sometimes. That larval phase has less fat than other larval phases. I think it's silkworms as well. But no, there isn't one that I think is bad. I wish we had duvia roaches in Canada. I think that would be helpful.
It would be, yeah.
But it would be nice. But I think they're advocating this a lot in a lot of reptile clinics in the States, capturing insects. Of course, if you think that there's an insect that might have organophosphate toxicity is circling on the ground and looks like it's dying, I wouldn't feed a dying insect to your reptile. But if you see a spider around your house and you have no insecticides around, I would definitely feed that. Or flies, not fireflies, toxic to reptiles. We don't really have those in Canada, I don't think. But I think a variety, those little bugs that you see that kind of roly-polies that roll up, those things too. I think variety is going to be great. And then making sure that everything that you feed that you have cultivated yourself is either gut loaded or dusted properly.
It's actually a really good point about catching wild insects, because that's something that you'll see people freak out online about. You should never do that because they probably have raid on them or something. But I started doing that as well, especially because now that I'm outside the city, it's easier for me to do that. And even if you're in the city, they're not, as long as they didn't fog from mosquitoes like the day before, you're probably okay. And a lot of insects do synthesize vitamin D from the sun, so they will have vitamin D inside them as well, which is one way that they do ingest oral vitamin D in the wild. But then you get all this variety, different proteins, all this different stuff, and I think that's a great way to go. And it's actually probably completely safe as long as, like you said, you're not collecting off a place that was just pesticides sprayed or something.
Yeah, absolutely. If you're doing it around your area, your house, you usually know it's a pretty big thing for them to spray a field, and they should tell you. I haven't seen a problem with it in any of my clients or myself. I've not heard of it from anyone in the States or around the world that recommends the same thing. Definitely heard of a lot more issues being caused by feeding the exact same larval bit of insect like a mealworm or a superworm.
Yeah. And just enrichment wise, having different flight patterns or different movement patterns is going to be so much better for the reptile to have to learn how to hunt different critters and whatnot. So that's a great idea.
I think it would smell and taste different. I wouldn't know, but I'm not
sure they do.
Yeah.
Well, they definitely have preferences. My day gecko won't eat silkworms. I guess they don't taste good to her, but some reptiles love them. So
yeah.
No, that's perfect. I think, is there anything else on the supplement side that you wanted to mention before we move on to the next thing?
I don't think so. I was wondering if I had anything interesting. I had a couple notes down. No, I don't think, especially insectivore wise, I think the vitamin A was probably the biggest thing for supplements.
Okay, so let's move on. I think you had mentioned one of the things the bullet points you give me was the myth of goiters, and I think that folds in well probably with just the diet myths, right? With desert tortoise and whatnot. So do you want to just talk about maybe feeding tortoises, and then we can go from there?
Absolutely. Goiter came about a long time ago so goiter in a human, they have that big kind of bulge on their neck, and it's their thyroid gland. And so the idea was that, maybe their tortoises don't have, this is the big land species tortoises like sulcatas, and I think it's more in aldabras, bigger tortoises that have this swelling on their neck, and everyone thought, it must be a goiter because it looks exactly like a goiter, and it does if you compare the pictures. But there's a guy who did a study on, I can't remember which year it was, but he in his practice saw 4 tortoises that had this goiter esque looking thing on their neck. And he had the brilliant idea to biopsy them. So he biopsied all of them, and 4 out of 4 of those tortoises came from the thymus, not the thyroid. And if you actually look at where the thyroid is in a tortoise, if you do dissections on them, it's really close to the heart. It's not at all in their neck.
Interesting.
That's not what it is. But there's this idea that I think in humans, it can be caused by certain things that you eat. I should not get into human medicine because I know nothing about it. But
it's caused by like hypothyroidism. Is that like an inactive thyroid or?
Yeah, I mean, I shouldn't say yes or no because I don't know anything.
Okay, yeah.
But it's not a true goiter. I think that the worry was that brassicas, so that's like a whole family of plants. So I think cabbage is in there, kale, spinach and cauliflower and broccoli, all those type things, and mustard greens. That those things that were high in oxalates. But I don't know if they directly related it, but they thought that those kinds of things would cause goiter in tortoises, and it seems that is not true.
So was the swelling on these tortoises' necks, was it an issue, or like was that something else, like another medical concern, or was it more like whatever, you got a big bump on it?
I don't remember it as being a concern. I just remember thinking everyone assumed this was goiter, and then they're like, it's not goiter. But now that you mentioned that, I don't remember if the study said that the tortoises were sick in any way. Just saw the swelling.
Yeah.
What I have seen for sure in land tortoises is generalized swelling or edema. And that happens when they don't have enough. There's many things that can cause that, but for the most part, that happens with bad diet. A lot of tortoises, land tortoises anyways, are fed a diet that's very high in protein, which is not normal for what they feed. So they're like hide and gut fermenters, right? They're like rabbits, and this only makes sense in my mind, but they're rabbits and they're horses and they're guinea pigs and
cattle.
You wouldn't feed a guinea pig straight kale and dandelion greens only, and lettuce and all these kinds of and fruits. You wouldn't feed it because they would get very sick. They blow out with diarrhea and get sick pretty quickly. Most of them. What do you feed rabbits and guinea pigs and horses? You feed them hay.
Right.
And hay, if you look at, there's a bunch of charts that, I mean, you can post them. This is all public knowledge. You can post them on your Instagram, maybe a bunch of charts that show what kinds of protein and fat and carbohydrates are all, and calcium and phosphorus concentrations are all in these typical grocery store things that we feed. So everything from cabbage to kale to iceberg lettuce and all this kind of stuff. And then it shows different hays. So like Bermuda grass and Timothy hay and orchard grass, all these types of things. And then they look at we know the most about. You call them arid species. I call them desert tortoises, same kind of thing. The land tortoises that usually get quite large, and they mostly eat what we think of as grass or roughage around. They looked at what they eat, and then they compare what we can buy in the grocery stores compared to what they eat. And it's absolutely wrong. The protein is way too high. A lot of times the carbohydrate is way too high. The fiber is way, way, way too low. So it just doesn't match up at all. And over time you think, I can just eat a bunch of protein. It's no big deal, but we're omnivores and we can get rid of it. Herbivores that don't eat high protein can't that often. They're not as good at it, and it can do bad things to especially their kidneys, and a lot of organ failure can happen. They can get not enough protein in their blood, which seems counterintuitive, but they can get edema, so they'll get swelling and they'll be lethargic and weak. And for the most part, I think that's because they've been fed dog food's the worst. I've seen that before, but even grocery store vegetables, even iceberg lettuce is too high in protein.
Well, it's funny because I think there's this problem with our own brains, because you see it all the time. People make their tortoise like a nice salad and it looks healthy. You got all these greens and then they throw like a couple blackberries in there and then they dust it with the stuff and you're like, oh my God, it looks so healthy. But really it's healthy for us maybe as a person that we can digest it. And really in the wild, these animals are eating what basically looks like dead grass to us.
Yes, 100%. Yep. And so I think, so if you're looking at take a sulcata, for example, and you're looking at what kind of diet you want to feed them. And the hard thing is too, I know I'll tread on some thin ground here, but there's this big push against commercial diets for land tortoises. I've heard this in the vet world anyways, that, that's way too high in carbohydrates and your tortoise is going to get sick if you eat that. I don't think that's true. If you look at the composition of what's actually there, I would recommend for a land tortoise to be eating 80% of their diet a mix of a high quality pellet. So I like Missouri LS. I think it's pretty good. There's a couple other ones that aren't bad. That's still going to be too high in carbs because you need things like wheat middlings to make this pellet stick. But then mixed with hay, you can chop hay up with a knife or in the blender I mix hay in a food processor and mix water with it, and I soak the pellets, and it's like a kind of mash. So that's most of the diet. And then you can supplement with other things for enrichment. Like it's okay to do dark leafy greens. It's okay to do things that are high in oxalates, which may be something we should touch on. So spinach has high oxalate content, but so does prickly pear cactus. And that's a really big part of the diet in certain times of the year for these arid desert tortoises in the States.
And what about fruit?
No. Well, I shouldn't say no as if never. I mean, have I given my tortoise a bit of a raspberry before? Absolutely, I have. But there just aren't any raspberries in the desert. And what's in those in the berries, for carbohydrate wise, just doesn't fit with their diet. And anything in moderation. Honestly, I'm not going to say never give your tortoise anything in the red, orange color group or anything fruit wise. I can't say that because I definitely have done it, but it should be less than 5% of the diet, which is okay. That's a once a week kind of fun treat. And I don't have a problem with that. Same thing with beardies. Actually, there's a good study done in beardies, and it was totally jumping between species and omnivores, kind of herbivores. But there's a pretty good correlation between fruit being fed and dental disease. So it's not periodontal disease because they don't have those ligaments because they have acrodont teeth that just kind of sit at the surface of their jawbone. But that kind of black buildup and then teeth falling out from bearded dragons usually is related to a high sugar content in their diet because it changes the flora. They think, we haven't done a study on it yet, changes the flora in their mouth of what kind of bacteria are there.
That's interesting. Yeah, and that goes back to people. Again, we think fruit is healthy, you're going to feed it, but yeah, it's probably not the best. Let's jump back to the spinach for a second because you had mentioned the oxalates and why people think that may be a bad thing. Was that associated with the goiters as well? Because I think you had, was it the oxalates that people were thinking were causing the goiters?
There are maybe three things with the oxalates. One is the goiter thing that people used to think about. The other is that in foods that have a high oxalate content compared to calcium, so the molar ratio being greater than 2, so greater than 2 oxalate content to how much calcium there is, that is not the best food to feed. Is it poisonous? Is it detrimental in low amounts? Absolutely not. You can feed spinach to your reptiles for sure. If you have a tortoise that's young that has metabolic bone disease, the colloquial term, but other terms for it are there. If you have a tortoise that's that sick, should you feed it 100% spinach? No, of course not. But the idea that you should never feed something like that is high in oxalates, that isn't the reason. So prickly pear cactus is one of the highest oxalate foods that we feed, but the ratio of that to calcium is less than 2. So it's not that big of a deal. And these guys eat so many foods that are really high in oxalates and they don't seem to have a problem with it. So that's the other thing is the oxalate to calcium ratio. And then they had one more thing that they were worried about: stones. So calcium oxalate stones, I shouldn't talk about human medicine, but I'm going to do it again. I think are a thing in humans. And so maybe this is where the thought came from, is that if you eat foods that are high in oxalates, you're more likely to get urinary stones. What the urinary stones are made of, and they've done studies on this as well, is not calcium oxalate. There's been very few stones found that are actually calcium oxalate. They're usually urate stones. So they're stones that are made from what they pee off usually. So that white part that you usually see in the urine. So that's usually what those stones are made of. And it happens a lot in uromastics, because I think people don't provide them with enough water or any water at all. So I see it all the time, but those are what those stones are usually made of. And sometimes they're calcium carbonate, but not as often. So I think those are the three main things with oxalates. Is there's just a bit of an old wives' tale that they're terrible. They really aren't terrible. It's just that you don't need to feed foods that are high in oxalates and low in calcium forever, because they're not going to get enough calcium in their diet.
Right. Oh, yeah. So again, it's sort of the moderation thing. They're not poisonous. And I think that's where they get labeled all the time. Like spinach will cause the animal to die or something, or get super sick. Really, it's not going to be a problem. But again, if you're overly doing it and you have an animal that's already deficient, that's where a problem arises. Is there an easy way to figure out what level of oxalates are in certain plants, or really is it just spinach? Like what else is in the grocery store that would have high oxalates that people would maybe worry about? Really spinach, I think.
Kale.
Oh, and kale. Okay.
Dark kale as well. I thought I had some written down. Oh, kale, cabbage, mustard greens. So all the brassica type ones usually.
Oh yeah. Okay. Yes. Okay. Gotcha.
But it's not that they are bad foods to feed. It's just that can't be the mainstay of the diet. And at the end of the day, the mainstay of the diet shouldn't be low oxalate foods either, like even lettuce. So romaine lettuce and iceberg lettuce, green leaf lettuce are all, it seems like there's nothing in them to us because we don't get full after eating lettuce, but there's actually pretty high protein content when you compare that to hay.
Interesting.
Yeah. Hay sounds like people will say, oh, tortoises don't eat hay in the wild. And that's true. Hay is dried grass, but there's certain species of grass hay.
Right. Yeah, that makes sense. And I think one thing that we want to mention too is I think it is a good rule to not use spinach as gut load. Is that right?
Yes, I wouldn't use spinach as gut load because there is an 8% spinach content with it because there's also a high oxalate content. Oxalates can bind calcium, so you might not get as much calcium from that food that they're eating and other foods that they're eating as well, and they mix in their GI tract. I can't just say only feed one product, but the makeup and the calcium concentration in Missouri high calcium cricket feed is great. You can feed that to just mealworms all the time, then you wouldn't actually have to gut load because they're eating something that's proper, but you can't offer them anything else. So they're just like dogs that want table scraps, or when someone says, my tortoise will never eat that mash or that softened pellet, they will if you don't offer them the table scraps anymore and you're persistent for weeks and weeks and weeks.
Yeah, eventually get hungry enough.
Yep. And things with high calcium in them don't taste very good. So if you offer anything else to the crickets, or to the crickets too, but to the mealworms that you have at home, they're going to eat that other thing. So for the most part, if you set up a mealworm colony, have only that high calcium cricket feed or a cricket colony. And then for the mealworms, I just use a paper towel that's misted every couple of days. So it's just a bit moist, not damp, because you're going to get mold, and mold can make reptiles sick too. So you want to make sure what you're feeding is good quality. And then that'll be enough so that the worms don't die of dehydration, because they do often die of dehydration. The same thing with crickets. They'll all not do standing water or they'll drown in it. Just a little dish with a cotton ball that's soaked in water in it, and that should be okay.
And then jumping back to the offering water for maybe some of the more arid species, uromastyx and bearded dragons, and whatever else, you do often see that people don't provide a water dish. But as far as you're concerned, a water dish is something that everybody should have?
I think that unless you have a pet rock, you should have water available in some sense. What I often get from my clients is, well, I never see my beardie drink out of the water dish, and that's common. Beardies are dew drinkers, like your day geckos are, like chameleons are. So that's not going to be a way that they're going to drink. And even a lot of land tortoises too, the ones that are supposed to be in arid species that are in the desert, they do dig burrows, and they live down there in higher humidity, 50 to 60% humidity. And at the base of their burrows, the entrance, they often will dig a little rain catch, so a little hole that's in the dirt, and then when it rains, they have that puddle, and they'll often preferentially drink out of that versus a higher based bowl, like a dog bowl. I still see some land tortoises that are very good at drinking out of bowls, but if you have, say, a Euro, or if you have a beardie, how I usually get water into my beardie is I do give him a mash of some different things, and I soak it in water, or I have a very shallow dish of water, and right as he's going to eat his insects, they'll be in there. So when he misses, he gets a bit of water. And then baths. They're pretty good at, if you're in a warm water bath and you drip water in their nose, they're going to get some water into them. I think that if they're not in their natural environment and we have them in captivity, it's our duty to try and mimic nature as best we can. And a water dish, although it's there, I think everyone should provide it, but you still actually have to do more.
Right. Yeah. Whether misting or just making sure they're getting contact with water somehow.
Or a dripper, depending on what kind of species you have. It's a really big problem actually in Alberta, because it's so dry here. Yeah. That chameleons are probably some of my favorite species. And it's really hard to keep them because they chronically will get renal disease because they're chronically dehydrated. So oftentimes when they come in, we ask about the parameters of how they're kept. And it's really hard to manage high humidity that they truly need, and high enough humidity that dew actually forms, or if you have a dropper, and then bacterial growth, right? Because you need airflow, but the airflow in Calgary is going to be incredibly dry. And so it just wipes everything out. So what do you have? A whole room for your chameleons? It's probably the only reason I don't have a chameleon is because I don't have a nice humid room. Maybe one day.
I know it's one of the struggle that I have too in the winter. It's just horrible. That air is just so dry. The heat's pumping all the time, and yeah, you need to have high ventilation. That's one mistake you'll see people make too, is they just blast like the ultrasonic humidifier into the enclosure, and then it's just like a fog storm, and it looks cool, but at the same time, the animal's probably like breathing in all this bacteria, and it's good like hydration wise, but not good, breathing wise. So yeah, it is definitely tricky. So that's a great point to make. Is there anything else that diet wise that we wanted to mention?
I'm just looking to see if I had anything else on the list. I don't really think so. One other thing about hydration in bearded dragons, because it's a common problem. Beardies coming in constipated. I think this is multifactorial. I'm sure it is diet related, maybe not enough fiber. We still don't have very good studies on what bearded dragons eat in the wild. I haven't found any, and we always lament about it. I think it's a diet not high enough in fiber. And I also think they're chronically dehydrated as well. I feel like they don't get enough water. And what happens when they don't get enough water is that they don't urinate as much, and they don't get rid of the urate. So they don't get rid of that concentrated bit that comes off of the kidneys. So that white kind of plug, and they really, it's a good adaptation that the body has, if they can make that plug of debris that comes off of the kidneys, that waste that they don't need. But in the other sense, it doesn't mean that they're properly hydrated all the time. Just because we can make our pee dark yellow doesn't mean we always should be. So what will happen is they will make that urate plug, because they're so dehydrated, they can't actually produce water urine from their kidneys. They produce a solid waste, and that sits directly above their colon, right? So if you think of the anatomy of a bearded dragon, that top part's going to be coming from their kidneys, the bottom part's coming from their GI tract. And when it sits above there, and it's actually quite firm, it pushes on where the colon is. And not only does it make it difficult for them to pass stool, but it makes it probably painful. And then the longer, just like us, the longer that their stool sits inside of their rectum, the less moist it's going to be. So the rectum's going to pull out water from it, because it needs more water for the body. And then they don't poop as much. And oftentimes when I get them to poop, so I will manually stimulate them with a cotton tipped applicator, so like a Q-tip with some lube in it, and I'll just kind of massage their vent area. And when they poop, that plug will come out too. Sometimes it'll have blood on it because it's been there for so long that it's irritated the mucous membranes, the lining of that vent. And so that's the worry too. So just another reason, if you think your bearded dragon is constipated, think of reasons maybe why a person could be too. You gotta drink more water, and you should find a creative way to get beardies to drink water. And
so in that scenario, is doing the manual sort of Q-tips thing, is that going to most of the time help pass the stone, or sometimes you have to go in surgically and actually remove them?
So they don't usually get stones. They don't have a bladder like iguanas do. And now I'm getting into which species do I exactly remember have a bladder, which is a long list of yes and no. So sorry if I make a mistake. So it's not really a stone, but I call it a plug. So it's just a buildup of urates that they have not passed yet.
Okay.
So anyways, so it oftentimes will get rid of both things, but I'd probably say I'm like 80% successful. And usually they've come in because, he hasn't pooped for so long. I don't know what's going on. They're not moving around because they live in a 4x2 tank and they don't get out that much. I'm not saying that's a terrible thing. It's just the reality of being a bearded dragon in captivity. They're not hydrated enough. They probably have too much protein in their diet. They need protein because they're omnivores, but their veggies probably don't have high enough fiber. And then they're dehydrated. So all these things together makes for a beardie that can't poop.
Yeah. Okay. No, that's good to know. Well, why don't we jump into some of the questions that I got off of Instagram? I think we have a decent list. And the first one was to do with cancer. I think one thing, we see lots of cancers in mammals, obviously, rats, small rodents. And I think cancer is one of the things that we don't often think about in reptiles. So the question from the listener was, how common is cancer really? And is it something that we should be concerned about, especially when it comes to overexposure of UV? Because obviously we're seeing a lot more UV usage, which is great, but is that causing skin cancer of any sort? So maybe I'll just let you run with that.
Yeah, I think that's a genuine concern about man-made UVB lights and cancer. I can't say I've ever seen a case where I thought absolutely that was a UVB light, but I've definitely heard through other reptile vets in the States that the biggest worry about those small screw-in UVB bulbs that are concentrated is that they produce a concentrated area of UVB. And you can measure that. That's true by your UVB meters. So there's high UVB in one area and then nothing on the other end. Not only does that not mimic what happens in the natural environment where you have from head to tail a very similar UVB spectrum, but it also brings in the worry of if you have to have something that's that concentrated to give them enough D3 in their body to do normal bodily processes, are you at risk for melanoma or chromatophoros, which is what we often call them in reptiles because they just have a different cell. Doesn't really matter. But I've seen melanoma in beardies. I've seen it in chameleon as well. And they're usually very concentrated areas. And in areas where I wouldn't have expected it to be from the UVB lights, they haven't just been on the back or the top of the head. I think that even though we don't have good enough evidence for absolutely every time you have a small UVB light that produces a lot of UV in one area, that's always going to cause cancer. I think we should assume that let's just do it as best we can. I think that a T5 bulb or a bulb that's spanned a more even UVB over a large area is going to be the best way to do it. So that's melanoma. For other kinds of cancers, I think another question that one of your viewers had was, what are some common things that you can see that aren't husbandry related? I do see cancer. I've seen cancers in a lot of different areas on reptiles and in the same kind of variety that you would see in dogs and cats and all the other species that we see. So is cancer a thing we should be worried about? I mean, it's a possibility. Any lump and bump can be something bad, or it can be something that's not that big of a deal. So I think you should always get them checked out. But I can't say for sure this UVB causes it and this UVB doesn't. I think it's important that we get them outside into normal sunlight as best we can in the summertime when the temperatures allow us to. I think that we can't recreate the sun, even though we try.
Yeah, no, that's definitely true. I think moving to outdoor keeping to some capacity, I think it'd be really helpful for many reptiles. Something that I want to do, even though it'll be only like a couple months of the year, but still worth doing. And what about treatment for cancers? Is it surgical? I guess if it's small enough or like a tumor you can pull out, but other than that, I'm sure in some cases there's nothing you can do.
No, and I recently had a case where there's a tortoise that had lumps all over her body in weird areas. They don't have true lymph nodes, but it looked like she had lymph nodes everywhere. And at first I wrote it off in my mind as her being fat. And then I did blood work and then I did a biopsy and it looked like lymphoma, which is so odd. And I asked, the people that write the textbooks and they hadn't seen it before either. So because they hadn't seen it meant that if it had been seen before, it definitely hasn't been studied or definitely hasn't been written about. So there are no treatments for it. Basically in a reptile, if I see something that looks odd and I biopsy it, if it's small enough, I will do what's called excisional biopsy, which just means I take the whole thing off and I sew them back up and I send it to the lab. And I said, I try to take the whole thing off. Please tell me if I got all of it. And they'll say, yeah, it was this type of cancer. And yes, you got all of it. And I'm like, great, only one surgery. But if it's a huge mass, it's going to be a really difficult surgical repair. You often will take a chunk, a little biopsy, send that to the lab and say, is this a big deal? And they'll try and tell you, is this something that you can take out with surgery? Has it metastatic? Has it moved places? So yeah.
How can the lab know if you've grabbed it all? Like, is there something with the tumor itself that they can see, like a membrane or something, or?
Yes. So what they would do is say you have a lump and then you try and cut out underneath the whole lump. And there's some different rules surgically wise for how you think you should get all of it. You can mark the edges of where you took it off and you write, please comment on margins. And the pathologist will cut it into slices and they'll look at where the cells of cancer cells look different underneath the microscope. They just like, look, they're dividing and they're weird. There's all the different ways you can know that they're cancer cells. And then it'll get to normal cells. If they see that all the normal cells are there and there's no invasion of the vascular system, so that cancer cell hasn't jumped into the blood supply, then they'll say, didn't find any evidence of invasion of the vascular system. Margins within 1 millimeter look normal. And then they say probably surgically curative, but so.
Makes sense. Yeah, that's amazing actually that they can do that. But no, that's great. What about Salmonella poisoning? That was another question that one of the listeners had. I think they're referring to, can poisoning happen to the reptile themselves, but I mean also that's something that we should be worried about as well, making sure we're washing our hands and whatnot, because that can happen to the keeper too.
Yeah, so Salmonella is a pretty common bacteria that reptiles will carry in their stool, and so will some other animals that we keep, so hedgehogs as well. You shouldn't touch reptiles or their poop and then directly put your hands in your mouth because nobody likes bloody diarrhea. But yeah, Salmonella, I mean, if you're being hygienic, I don't think it's really a worry for keeping reptiles. You should wash your hands after you touch most animals, especially reptiles that have Salmonella. But for themselves, I mean, there's going to be E. coli in their stool too. There's a lot of bacteria in stool that are not good for any animal. That's why poop's so gross to most people and to animals too. So if there was a breach in the GI tract, so within the lining, say that they were sick and there was like a leaky bit in there, there's a perforation of some sort because of trauma, or because they're sick in another way, and bacteria from their stool gets into their bloodstream, that will cause illness for sure. So whether it's Salmonella or whether it's E. coli, any kind of bacteria in the bloodstream is not a good thing. So it's called being bacteremic, having bacteria in your bloodstream. That can also happen from a cut. So say your animal cuts themselves and then steps in their poop. That can make them pretty sick too. So it's a worry insofar as any poop in a wound or any sickness and having poop near it. Poop is not the medical term, but I'm still using it.
Yeah. It seems pretty intuitive too. Like
sure,
keep the poop away from cuts.
Yeah. But insofar as it's a worry for anybody else, for any other species.
And then as far as, symptoms of that sort of thing, that would be probably similar to us, right? Diarrhea. And do reptiles vomit? Like, can that happen?
Yeah. Mm-hmm. I'm trying to think of a reptile that can't vomit. I think they can all regurgitate. I can't think of one. I mean, I'm happy if someone says, "Oh, this one can't, and this is why." But horses.
Yeah, I guess when I think of regurgitation happens all the time. It's weird. It seems different, but yeah, I guess that's true.
But since they're not ingesting it for the most part, they're not going to get GI symptoms from having Salmonella poisoning because that's normal for them to be around it. But the worry is having bacteria in the bloodstream. So lethargy and impotence, any kind of not obvious or any kind of symptom that's pretty generalizable to a bunch of different things they would probably look quite ill.
Gotcha. And what about at home first aid kits? Like, people always, minor injuries, maybe like a small burn or a cut or something like that. Is there anything that you think that people should have at home to be able to treat small things, or is that you think it should all be done at the clinic?
I'm trying to think of things. There's not many true reptile emergencies. I think a lot of them maybe seem like an emergency because they haven't been looked at in a couple of weeks and they look really bad. But any trauma can be an emergency, right? You stepped on it, they got caught in a door, they have a cut from something, but for prolapses would be a thing. So a first aid kit, I've never actually gone through one and made one or talked about it with any of my clients. But I don't think betadine's a bad thing to have around the house. So betadine or povidone iodine is this dark brown liquid. And you don't want to use it full strength. You got to make it looking like weak tea if there's a wound, because full strength can actually impede healing of the wound. So you want to make it weak tea and you can flesh out something. If, there's not really anything that I would say you must have. I mean, some wrapping things, so bandaging material might be okay, but the worry with bandaging is you got to be really careful because you can cut off the blood supply. So err on the side of loose and then tape to the body than anything else. And then, oftentimes if you call a vet clinic that knows what they're doing, they should be able to give you some direction onto what to do until you can get to an emergency clinic. And for the most part, if you get to an emergency clinic, even if they don't do reptiles, they can do some emergency medicine. If there's something like a fracture is not that different in a reptile as it is in a dog and cat.
Right. Yeah. But like you said, there's really not tons you can do at home besides keep wounds clean, really. Yes.
I'm sure there's a lot of people that will lance and express abscesses. And I'm not going to pretend that that's rocket science, right? Like would I prefer I do it in the clinic than someone at home? Yeah, I mean, you can mess up. You can cut something you don't need to cut. You can go too deep. It can not be an abscess. Any lump can be cancer as well or something else. But yeah, I think that betadine might be the most simple thing. That's just a cleaning agent. So I'm sorry I don't have more help on that at home.
Oh, no, that's good. No, that's perfect. Yeah. One of the questions was, case studies as far as doing reptile related case studies? Is that something that you do or have to do on a regular basis, or?
I'm not sure what they mean by case study. So a case study can be a paper that's written up in a medical journal on one specific animal. And I haven't published anything in a reptile journal. It's just about time. There's no other reason for that. I've got lots of cool case studies, but how many reptiles, if they meant how many reptiles do I see, or have I seen in my career, it would be thousands.
Yeah.
I graduated in 2017. So to do thousands in that time till 2022 now, it's pretty good. I see a lot of reptiles.
Yeah. Well, if you're seeing 3 or 4 a day, then it adds up real quick.
Yeah.
What about specific training for reptiles? I mean, this is always a question that we come back to, is because people do often have bad experiences taking their reptile to a vet because, like, as we said, you're taking it to a small animal vet rather than an exotic vet, and then, you know, things get wrongly prescribed and whatnot. And what are some things that vets do to specialize in exotics?
That's a good question. So all vets that get out of vet school are able to do any animal on the planet that is not a human. So we are, I mean, that's in your area that gets brought into your clinic. You are allowed to practice on it legally, but you might not know much about reptiles because there's so much to know. As I've said before, there's so much medicine and so much anatomy and dog and cats on their own that it's hard to then add in not just another kind of animal, like reptile, but way more species, thousands and thousands of other species. So as a vet, if you're already a vet, there are a couple websites that you can go to. So VIN, all vets out there will know what that is, the Veterinary Information Network. There's lots of CE on there, so continuing education. There's lots of people just chatting and saying, hey, this is the case. Does anyone have any help? And a lot of pretty good reptile vets will comment on there. And then Lefebvre is really good too. And I know you had another person that had a question about continued training, even if they weren't a vet or a vet tech. And I don't know what the regular website on Lefebvre looks like, Lafeber. I don't know what the regular website looks like, but there's definitely tech stuff. So vet tech stuff, so nurses, and then veterinarian stuff there. They have lots of really, really good continuing education, and then care handouts and all that kind of stuff. So I think those two places are good. If you are a vet and you want to learn more about reptiles, if you can go to the conference, so Exotics Con, it's the best place you can possibly go. It's lectures all day, the newest research that's out there, meeting the people that are actually writing the textbooks. And that's still my best thing in my back pocket that I have, is I can text the people that write the textbooks. And that's the coolest place to be in a profession, because I get to be on the forefront of the newest knowledge that happens. And if I ask a question and they say they don't know, it's pretty fun. It's fun to find new things.
Well, and that's, I think, what people don't realize, or it's sometimes because, you know, a vet is a very professional position and a very professional career. And sometimes as the consumer, we think that the vets know everything. And obviously everybody, you trust your vet that you find that you like. But really in reptiles, as we already said, there's so much missing information. We just don't know enough about their behaviors in the wild, what they're eating. You'd mentioned the bearded dragons. We don't exactly know what they're eating in the wild. And that's a really, really common species to be kept in captivity. And so it's pretty cool that you can be at the cutting edge of as we learn new information. And there's just so much to learn still. And it's going to be just a constant evolution.
Yeah, 100%. And I think too that in finding a vet that can see your reptiles, I think the most important thing is just going to be that level of honesty of them saying, hey, I don't see reptiles every day. I'm a vet. I definitely have nutrition training. I absolutely have medical training. I know a lot about a lot of species, but I don't know that much about reptiles. And a vet that's open to, if you were to say, hey, I know this vet in Calgary that will do consults because our clinic will do them. And, you know, you'd pay our consult fee and whatever your vet was going to charge as well, because I can't take appointments from people outside of my province. I'm not licensed to do that, but I can absolutely provide veterinary advice to another veterinarian in another province. If your vet is open to that, I think that's all you can ask for. It would take so much time for, if you came in with an inappetent tortoise, for them to even know how to listen to the heart. Because really in my mind, it's easy. You put a Doppler on this spot and you can hear the heart rate, but in their mind, it's frightening because it's a whole new thing. You don't want to mess up. You want to make sure that you provide good care to this animal, and you want to make the client happy. And I think there might be a tendency in some people to pretend that they know a lot. Like I can't pretend that every vet in the vet industry is perfect. Same thing in the doctor world. You should always, have a good relationship with your human doctor too. But if you have a vet that says, hey, I'm not sure, let's find out, that's 100% a good vet to be at. Would you like to be at a specialist reptile vet? Absolutely. But if you don't have that option, then don't write everyone off who doesn't maybe know the specifics about your species of animal.
Well, and that's the first time I've really come across a vet saying, with using other vets as a consult. I never really thought about that, but that's such a perfect way to go into, because you could imagine a vet might be even intimidated to sometimes admit that they maybe don't know exactly, what to do in this situation, and to maybe just approach it as saying, hey, I know this vet at this clinic that's a couple provinces or a couple states away, and they've dealt with this exact thing before. Would we mind setting up a call with them to figure out what to do with this animal? That is a really good way to go about it. Plus helps that vet learn about that animal and learn about that ailment.
Yep. I think it's great. I do a decent amount of them, and I do enjoy them because most of the vets that reach out that way are clients that have that relationship where them and the vet have decided to reach out. Mm-hmm. It's just, it's nice to know that they have that in their back pocket. It takes stress off the vet, takes stress off the owner. And then we can have that conversation about maybe where to go next. But the only hard thing with that is if there is medical stuff that needs to be done surgery wise, right. You can't expect your vet to want to do reptile surgery because it is a whole bag of worms. That's not the right.
It looks horrible. When I see you guys operating on these tiny things, it gives me so much anxiety. Like my hands just can't stay still enough, I feel like, to operate on something so small.
And not even just the physical aspect of it, but to open, say, a chameleon and see all the guts are black and think, it's dying. But that's just normal. And same thing for bearded dragons. When you open them up and you look at some of the mesentery, which is like the film that holds the guts and stuff together, right? It's black, which means death in mammals, but that's just a normal pigment on the inside. And then to know how to do the anesthesia and which medications to use and how to intubate them. Don't expect your vet to want to do surgery on a reptile, but if they are down to have a consult with you and to look, even if they want to look things up, say, I don't know, I'm going to ask someone and call you back. Great.
And there was another question about fear-free practices. This is something that we see a lot in vet clinics for mammals using this fear-free certification. And I don't think I see it. I'm not sure if I've ever seen it in reptiles. And is that something that you've come across before?
So I've heard of fear-free. I've seen it, I think, in birds before. I don't have a fear-free certification, and I haven't seen it in reptiles. Maybe I'm just delinquent on looking for it. I think it's an interesting way of going about dealing with animals, because that would be awesome if they could never feel fear. They could never be afraid of what's happening. I think reptiles I'm not negating this. I'm saying reptiles are very resilient. And for the most part, the most stressed animals in the reptile world will run away, or they'll just shell up, and you can't do anything with your patient when your box turtle is fully closed. Mm-hmm. But I think fear-free is a certification that makes sense in a lot of species. I think it can be hard. So just know that in, say, something like birds, if you're going to wait all day for it to step up and for you to hold it, and say the bird has never been toweled at home. So when we handle birds, we put them in a towel because it stops their wings from flapping. It kind of keeps them in one spot. So say they've never seen a towel at home, and now you expect your vet to practice fear-free handling with them. It's going to be really hard. It's going to take a really, really long time. And then your bird's already out of the house and they're in a place where it's stressful because they're at a vet clinic. So I think for people, I would just keep in mind that fear-free is cool. I think that's a cool thing to learn how to do, and at least learn about those principles in a lot of different animals. I haven't come across it in reptiles, but you should be able to, if you're allowed in your vet's clinic, you should be able to judge how they're handling just based on how kind they are to your pet. Mm-hmm. For the most part, no one's going to manhandle your animal and throw them around. And they should be gentle enough, even in opening a snake's mouth or asking someone if you have a long snake to support the rest of their body. I think intuitively you can know that this person knows what they're doing. And that's why I hated actually not having people in the clinic during COVID, because I felt like one place where I excel is just in handling the animal and touching them and having people see that I know what I'm doing. Mm-hmm. But it's hard now it's just over the phone, and it's hard to make yourself sound like you know what you're talking about without them meeting you in person and seeing how you handle.
Yeah, exactly. Yeah. Yeah, I think it's a good point. I think a lot of the fear-free practices for reptiles can happen at home with training. People are working with their animal, exposing them to new stimulus, maybe doing some like the towel wrap at home with the bird, for example, letting them get used to that. And you know, mentioning like if we're waiting for the animal to do something in the clinic, that is going to cost more money because you're using the vet's time to wait for the animal to do something. So probably a lot of it comes down to actually stimulating the animal at home and getting it used to things and kind of going that way.
Yeah. And you totally can train reptiles, and not even just in a training, this is a command and do the thing, but in getting them used to certain things, like being handled, snake open their mouth. And you should learn how to open your snake's mouth at home. I think that makes
I've never done that. I guess I should practice.
Telling you should now.
Yeah.
Business cards are great.
Yeah. They just slide in open.
Yeah. I mean, for the most part, if snakes are good, and if they eat, you don't really worry that much, but it's an okay thing to get them to learn how to do. I find that most reptiles that I've seen aren't that stressed. The only ones that I've seen that are super stressed, I just feel like I don't have to be as, not forceful, but I really do have to restrain rabbits and birds more than I do with reptiles. A bearded dragon can sit on the counter and I can pick up his toes and trim his nails and he'll just kind of look at me.
Yeah. Yeah, it's true. Especially when they're used to being around people. Snakes are often pretty slow and relaxed unless they're, you know, really, really terrified. But I think we covered everything. Is there any other points that you wanted to mention before we wrap up? Any other things that are you see popping up in the clinic that you wanted to talk about, or is that everything?
No, I mean, the only other thing I'll say while I'm on the pulpit is bearded. You talked about obesity in reptiles in another podcast for sure. Super common. The hardest thing I think I find about obesity in reptiles is it's really hard for the owner to know, because they don't get fat the way that we get fat. And so if you take a bearded dragon, I keep thinking to myself, I'm going to make this drawing of a beardy to show people what normal fat pads are like. If you think of a beardy, this is his body here. Truly, the fat pad should be like fingers on each side. You should be able to find them. They should be there. They're extra reserves for fat and for energy if they find no food at all. But I see a huge problem in beardies where the outside, they look okay. They almost look just like a muscly dude. But on the inside, their fat pads are so huge, they take up 70% of their coelomic space. So their abdomen they don't have an abdomen and a thorax like we do because they don't have a diaphragm. So the hard thing about that is their lungs are now, the space where their lungs should be is occupied by fat pad, where their GI tract should be is occupied by fat pad. And in animals like shinglebacks, if you think about a blue tongue skink, their skin is not stretchy. If they have fat pads in there, they'll take up so much space that their GI tract cannot function physically properly because it's a space occupying mass, and they won't be able to poop. And they'll say, oh, he's not eating. He's anorexic. He feels bad. He's skinny. Unfortunately, he's just so fat that he can't eat anymore. Those are hard cases, but they're hard because you have to convince the owner there's a problem, that the problem isn't what they think it is. And that the road to recovery is going to be really, really long.
It's so difficult for them to shed that fat, right? I mean, it just seems like reptiles will hold their fat a lot easier than a mammal. Yep.
That's why they are so resilient. That's the whole point, right? They're opportunistic eaters. So anytime something comes around that looks like they can eat it, blep, they're going to eat it. And they'll eat it and eat it and eat it. And he's so hungry. It's just like, no, that's what he's meant to do, right? They don't come across food that much in the wild. And we feed them really high quality food for the most part, sometimes too high quality. So that I think is a thing to be aware of. If people at home can just feel their beardies, leopard geckos get fat too. They're just not as easy to palpate and touch the inside of their belly as beardies are, but they should be like thumbprints on the side of your bearded dragon. They shouldn't be like these hands that are on the inside. And they're firm. They feel like, I don't know, they're like firm, like this part of your thumb.
Yeah, no, I think that is definitely a big problem right now in the hobby. We've talked about it before. We've talked about it with snakes as well. Snakes get fat pretty easily and they get power fed and a lot of times you can't tell. And when you can tell, they are so insanely obese, they're going to have a heart attack at some point because they're just full of fat bodies.
Yep.
Well, I think this was a lot of information for everybody. And I think, unless there's anything else, I don't think there's any other points I wanted to make. Can you let everybody know where they can find, and I always say this with the vets, please don't message Dr. Chapman with specific vet questions because, as she said, she can't answer those questions. But can you let everybody know where they can find you online?
Well, I have a personal-ish Instagram. It's at Kelsey R. Chapman, I think. Yeah, there's an R in the middle for my middle name. And we have a vet Instagram, which is at Calgary Pet Vet. And our website is calgarypetvet.com. So that's where you can find us online. My clinic is called Calgary Avian and Exotic Pet Clinic, and it's in Calgary, obviously. And you can call the clinic if you wanted to set up a meeting with me and your vet, but you have to make sure that you talk to your vet first. It has to be like a team kind of thing, and there'll be a set time as if you were there for an actual exam. So yeah, that's where you can find me.
Excellent. Well, I really appreciate this. I have a feeling this may be something that we could do on a semi-regular basis, because people will have questions, and if people put in the comments other questions and things that they have, then maybe we can revisit some things and kind of use this as a soundboard for people, because I know this is an area where people are always lost and confused, and there's always different ailments and things and myths and improper husbandry that we can always address. So if that's something that you'd want to do, I think we could definitely set that up.
I'm happy to do that, and I love hearing specific questions from the public, and them being able to ask any question that they would like, and us being able to talk through it, I think is the most important thing, is a free chatting about knowledge. That's how we stop any misinformation. I hate that word. I can't believe I just said it. But how we stop any of these old wives' tales maybe keeping on going, and just addressing the topics head on and being honest with what we do know and knowing what we don't know, and trying to figure out maybe what we don't know.
Mm-hmm. Completely agree. Well, Dr. Chapman, thank you so much for joining me today. It was an absolute pleasure chatting with you.
Thanks so much. Thanks for having me.
All right, that is the end of that episode. Dr. Chapman, thank you so much for joining me. As we said at the end there, I think it would be awesome to do this on a semi-regular basis. You know that these questions continue to pop up. There's always new questions to answer. So if you're good with that, I think maybe maybe 1 or 2 episodes a year would be something that the listeners would really enjoy. Listeners, if you want to see that on YouTube or hear that on the podcast, make sure you let me know. That's something that I think will be very interesting to many of you, but I want to hear the feedback from the listeners as well. And one correction, early on in the episode, Kelsey or Dr. Chapman talked about high calcium gut load, and she mentioned it from Arcadia, but it is Missouri. The second time she mentioned it, she said it was Missouri high calcium gut load. And so just a correction there. It is not Arcadia high calcium gut load. It is Missouri high calcium gut load. I wanted to make sure that was clear for everybody. And again, if you're looking for more information on this episode, make sure you head to animalsathome.network.com. If you'd like to join us on Patreon, head to patreon.com/animalsathome. Again, thank you so much to customreptilehabitats.com for sponsoring this episode of the podcast. And I think that is it. As I said in the intro, episodes are going to be somewhat scattershot, so I can't guarantee when the next one's going to be out, but I am recording 2 brilliant episodes later this week that I'm really excited about. So the episodes or the podcast will continue to roll. It's just going to not be as metronome consistent as you guys are used to, but we will get back to that as soon as possible.